So good evening, everybody. Today we are going to discuss on a topic called as occupational health and safety. That's from infection control. Okay. All of you must be aware of this word called as occupational safety because when we talk in NABH, JCI, your international audits, internal audits, always you have to notice that the auditor will talk or ask some question on occupational health and safety, not only asking question but also occupation safety is very important for the managers, every nursing head, CSST head, the housekeeping head. What all do you do to ensure safety of your employees? This question is always given and asked, and they will ask for proof. They will ask, what have you all done for the safety of your employees? So, the systematic management of workplace hazards and risks to protect the health, safety, and well being of employees, visitors, and others. The process of recognizing and documenting potential sources of harm in workplace. Now, you all tell me, most of you who are attending the session today, okay, you all are nurses, doctors, physiotherapists, healthcare team members, HR, housekeeping, and general maintenance. So you all tell me, in a hospital for the employees, for nurses, doctors, all these people, what are some of the hazards of occupational hazards? You all can message on the chat box. Which are some commonly known cases? Which all conditions are the healthcare employees at risk? Yes, sharp hazards, needle stick. So all this will come under biological hazards. Very good. Needle stick injuries. These are all under biological. Then psychological also, trauma, stress, abuse, stress about many things. Okay, that is coming under physical. So there are many other things. Then there are infections like COVID. When there was a pandemic, almost, yes, electrocutions. During the pandemic, what happened? All the healthcare employees were very much at high risk for getting COVID. They had to actually sacrifice. They had to stay away from family members. So that is again your infectious, biological. It comes under that. Okay, we will look into that. So occupational health and safety encompasses the social, mental, and physical well-being of workers, employees in all occupations. If there's a poor working condition, it can have effect on the employee health. Okay. As you can see in this image, spill. All your spills can cause infection. All your slip can cause problems. Slip is your musculoskeletal problems. Slip can be for your patients also, and for all your, if your floorings are not safe, even the healthcare professionals can have falls. Also for 12 hour standing duty, especially in OT, ICUs, wards, that can cause musculoskeletal problems, spine problems, back problems. I'm sure now in all those who are attending here, at least 10% of you all will be having a back problem. Okay. Yes, Binia is having, I think. So that is one. Just 1 second, huh? Yeah. No, I got disconnected. I'm so sorry. Yeah. So, so what are the professionals that keep you safe at your workplace? There are some specialists, no, not only related to healthcare in general. You know, when you have these companies, multinational companies, or when there is like an engineering, a power plant company, they have their injury prevention specialist. They minimize risk of accidents, environmental protection agent, occupational health nurse. So occupational health nurses in companies, that's a very good scope in nursing. I don't know. I had two, three of them in my joining this course. Occupation health nurse. So they join the companies and they take care of the employees. So if there's any injury there, to assess the need for any specific arrangements to be taken, what kind of vaccinations to be given, all that will be done by the occupational or the industrial nurse. Okay. And if I don't know if you all are aware of it, like even when we complete our courses and all, we also have occupation health and safety course, antimicrobial. We will talk to you about that later. That is also very good. Then fire inspector, fire safety. So they are responsible for the safety with regards to fire. Safety manager, safety engineer, construction inspector. You know, construction inspectors. Recently, there was a what is that tall building that fell off. You know, during that heavy rain 2 or 3 weeks back in Mumbai. So that headache is of the construction inspector. They have to keep constantly having inspections at the stipulated time so that people are safe, and all constructions, if it is old or if there's some crack, you need to rectify that. Well-being managers, industrial hygienist, safety specialist, safety technician, trainer, intelligence and analyst, safety coordinator. These are some terms, not for you to learn it, but at least you should know them. Okay. Now, most common occupation infections of the concern in health sector are TB, hepatitis B, hepatitis C, HIV, AIDS, and respiratory infections, coronavirus, influenza. So these all kind of things are easily contaminated. Okay. And specifically, the ones who are going to get the most affected are the doctors and the nurses. So all the hazards, suppose somebody asks you, what are some of the occupational hazards? To give a better answer, you can always subdivide into biological, psychological, physical, ergonomic, and chemical. Okay. As you can see in the screen, biological, may you will have your blood and blood for fluids, needle stick, all that will come under that. Psychological, may your stress and all. Ergonomics, may you have your musculoskeletal disorders. Then you have your other conditions. Radiation. If you're working in the radiation department, your exposure to radiation, you have the badge, right, to check that. Now, what is PEP? What is the full form? Post exposure prophylaxis. HIV PEP or post exposure prophylaxis is a short course of HIV medications taken very soon after possible exposure to HIV to prevent the virus from taking hold in your body. Normally, post exposure prophylaxis has to be started within 3 days. Okay. It's used only in emergency situations, only when you are sure that you have got a prick. Okay. Now, you all tell me, any of you, if you have heard of it or read your SOPs, which are the drugs that are included in PEP? Which drugs are there? Anyone? Actually, I had already forgotten all the drugs. Yeah, antiretroviral. Correct. Zidovudin, lamivudin. Correct. Acyclovir. Very good. Okay. You all remember. Actually, I working in the hospital, it's been almost 8 years, so I have forgotten it. But I have mentioned it in the slide. Yes, you all are right. Now, always remember, each one of you, when you all are going to the hospital, one small assignment you need to do. Many staffs, Virade, yeah. So many staffs are not aware of the post exposure prophylaxis. Okay. What is your small assignment is you have to open your infection control SOP and go through the post exposure prophylaxis of your hospital. What is there in that? It's always good to learn that. Okay. Another thing is how within how many days you're supposed to give. Suppose then when do you do the retest? All these things you should be aware of. Okay. So this is a small assignment if you want to understand for your knowledge sake. Okay. Then PPE and vaccination of the healthcare workers. All waste handlers should be provided with masks, caps, gumboots, gloves, disposable apron. Like all your PPE should be given. Okay, personal protective equipment. And which is the most important vaccination that you need to give? Hepatitis B. And hepatitis B vaccination, the biggest challenge is that the new joinees they take, yes, Hep B. The new joinees, they will not be vaccinated. They'll take their first dose and they themselves forget when to take the second dose. So the hospital has made the rule, whichever I was working in, that once they take the dose, it's free of cost. Second dose, if they don't remember their particular date, then they will have to pay for that dose. So now people got streamlined. Otherwise, they're not bothered. They like emergency nurse will call us and remind us. How will they remind everybody? But then because of this audits, it became so compulsory that the recording has to be very clearly mentioned. So those who have already taken, it's okay. Those who have not taken, it would be given in your emergency department. So how long do you need to take the PEP? If you are prescribed PEP, you will need to take the HIV medicines every day for 28 days. Now this you don't learn from here. Each hospital has its protocols, 4 to 6 weeks at 3 months for other lab tests. You check the lab test and whatever is it's depending on the reports that you do. Then another important thing is training of all the staffs. A regular training of staff should be given. And in fact, in the last 5 years, occupational health training documentation very very important. That is why all of you might be having once at least this topic of occupational health hazards. Especially these topics will be taken before your audits in the hospital. Okay, so it's very very important. Then management of exposure to HBV. Suppose you get hepatitis B. So for percutaneous or mucosal exposures to blood, several factors must be considered when making a decision to provide prophylaxis. Okay. Then the HBS status of the source. So suppose if it's a needle stick of an HBS AG positive, HBV positive, then how virulent is that patient is have to be considered for the post-exposure prophylaxis. Okay. Such exposures usually involve persons from whom hepatitis B vaccination is recommended. Okay. Any blood or body fluid exposure to an unvaccinated person should lead to initiation of the vaccine. Most there shouldn't be a chance like that because the vaccination is done given at the first week of the person joining the hospital. Okay. All healthcare workers at risk must be vaccinated. That means doctors, nurses who are in direct contact with the patients have to be vaccinated. This is a recommendation, but lamivudine, they are the backbone of the drugs. Zidovudine, even for children, you have special doses. But you don't study this, study what is there in your SOP. Nothing is coming for exam from this chapter, okay? But maybe one question will come, but not related to drugs and all. It's just for your knowledge. Training of staffs, as I told you, it is so important. You need to keep a documentation. If you want a pre and post test, you can at least once in 3 months. So you should take this topic for training. Okay. Then exposure to HIV. What are the 6 steps that are indicated for managing occupational exposure to HIV? Manage the exposure site, remove gloves if appropriate, wash the exposed sites thoroughly with running water. Till now, in my experience, I have not got anybody who has been positive. There were cases where needle stick injury happened with this. Mostly it was for the housekeeping people. Nurses, I am not really sure. They have got needle stick injury, but the person was never infected as HIV or HBV. Okay, so that has not happened. But I have known many housekeeping people who have got serious problems, and one person was actually had got HIV. So there are risks also, because housekeeping people deal with the maximum sharps. So it's very easy for them to be succumb to such. They are more vulnerable. Do wash the skin with soap and water. Do not panic. Do not put the prick finger in the mouth. Do not squeeze the wound or blood. Do not use bleach, chlorine, alcohol, betadine detergents on the wound. Okay. Then you go to the infection control nurse and check for eligibility for PEP, mild exposure, moderate exposure, or severe exposure. They will tag you on that basis, and then they will decide whether to start it or no. Okay. A baseline rapid HIV testing should be done before starting post-exposure prophylaxis. All right. Then initiation of PEP where indicated should not be delayed while waiting for the result of HIV testing. The results come after some time, but you have to start it. Okay. Informed consent should be obtained before testing of the source as per the National HIV Test Line testing guidelines. The exposed individual should be assessed for pre-existing HIV infection. Okay. And the people who are HIV negative at the time of this potential exposure. Also, individuals who are known to or discovered to be HIV positive should not receive PEP. They should be offered counseling and information on prevention of transmission. Those who are already having, they don't need PEP. They are already undergoing their treatment. Okay. Exposed person should receive appropriate information about what PP is. Okay. And there are always two types of regimens. One is your basic two drug combination, and the expanded form, that is the three drug combinations. Okay. And the fastest you can do is within 2 hours. All clients starting on PP must take it for 28 days. If exposed person is pregnant, if it is pregnant, should she take it? Come on, tell me. She should take it, no? Yes or no? They will discuss the medications and then accordingly alter it, but they will have to take it. Okay. You have to check the risk and the benefits of her and the fetus. Data regarding the potential effects of antiretroviral drugs on the developing fetus or the neonate are limited. Okay, this is clear. There's a clear contraindication for efavirenz and indinavir prenatal. So these drugs you don't give, but there are drugs which you can give. So in conclusion, for a female HCP considering PEP, pregnancy test is recommended if there is a chance that she may be pregnant. Okay. So if a female, a conceiving age while a female is there, she has to check her pregnancy test also. Because who knows whether she was pregnant. When offered HIV testing, the exposed person should receive standard pretest counseling also. Confidentiality should be ensured at any cost. Okay, and do not delay PEP if HIV testing is not available. Recommend baseline laboratory evaluation within 8 days of exposure. Now, suppose there is exposure to measles and varicella. Measles, varicella is contagious, right? So administer measles vaccine to the exposed susceptible person within 72 hours. Okay. Now, measles and all, we don't know. Some hospitals don't admit infected cases. Okay. Now, a person who's having measles, the nurse is at a very high risk to be contaminated. It can spread. So, mostly people have already taken the vaccine. Those who have not taken should take the vaccines. Specific, even for TB patients. TB patients. How many of you have worked in with TB patients? If you all have worked, you all are advised to have a good high protein diet, take care of wear all your personal protective equipments, use N95 masks. We had it in my batch. There was one girl who got affected to TB after taking care of a TB patient. There's one hospital in Bombay, in Sivri, only for TB patients. Very risky. They used to scare us when we had to go for that posting, because every patient is TB patient. The risk is very high. And once you get TB, your lungs are always with pneumonia and infection, and you have to continue the medications for almost 9 months. So, TB risk areas such as medical wards, chest clinics, bronchoscopy units, radiology units, laboratories. If a staff member has been exposed to TB, they should report to the infection control practitioner or staff health nurse depending on the hospital protocol. Then, exposure to meningococcal meningitis. Transmission of meningococcal meningitis to healthcare staff is most likely within 24 hours of admission of the patient prior to the patient receiving the chemoprophylaxis. Healthcare workers in close respiratory contact with such cases should receive chemoprophylaxis with ciprofloxacin or an effective alternative agent. Okay. So this was with tuberculosis and meningococcal meningitis. There are a lot of side effects of these things. So basically, all the all healthcare people are risk for such kind of infection. What other cases can be there? One is your radioactive chemotherapy units, radiation therapy units, where you have the badge for exposure, and then you can shift the department if the limit, if your levels have increased. Where else? You're standing. Nurses have a long standing duty. Operation theater. You will have varicose veins. What can be done in such cases? You will have to keep your wear those stockings, and also make sure that before it was like the nurse should always stand, but now it's not like that. Hospitals have become flexible. If you finish your work, you can sit, and each nurse is given a chair. Am I right? There was a time, no, where you can't stand, you should always stand. It was before, it was like that. Now people have become more empathetic. Yes. We can sit, don't stand when you forget. Drink a lot of water, because when you don't drink water, then you are at high risk for stones. Then staff burnout is there. When you're taking care of 3, 4 patients, continuous night duties for 7 days, 8 days. Nowadays, are not there, but still. So there are a lot of things. Now we've completed the topic, but I want to tell you about the scope. Okay. An occupation health nurse has a great scope, because it's not only in healthcare but in companies. Nowadays all companies, they need someone related to the safety. And who would who is better than a nurse, because she knows about it. And if you have a certificate, nothing like it. So NHC is providing occupation health and safety nurse. During the examination time, you will get the options to select whichever you want, additional certification. Okay, that really helps you in your career. Hmm? Then even grievance handling. If there's any abuse that has happened to any of the departmental nurses, doctors, and all, you must inform the grievance team. You must inform your next in line superior. If there's no action taken, it's okay, this always happens, and they don't take it seriously, inform your HR head. The HR head is always there in the grievance redressal committee. Okay. Then about your infections, always remember, whatever may be, however busy you may be, if it is any contagious droplet airborne infections and you have to take care of that patient, make sure to put your personal protective equipment. Many times after needle stick injury, you're just very much worried about what procedures have to be done, the post exposure prophylaxis, and therefore you will not tell anybody. But make sure to inform. It is very important. Don't neglect these kind of things. Don't be careless. Okay. Then little bit we'll do about needle stick also. Needle stick injury, if you have, it's the same thing. Again, post exposure prophylaxis, inform. Nobody wants to inform because they're scared. They did not follow the protocols, and that's why they got the needle stick injury. But don't be like that. Make sure you inform the infection control nurse and start your post exposure prophylaxis immediately. Okay. And do not recap. Needle stick injury, there'll be at least 2 questions for the exam. So, most important is no recapping of the needles. And if you have a needle and a syringe, where will you discard it? Syringe with a needle where you will discard. Come on, tell me. Do not separate the needle and the syringe, okay? If you have, yeah, you have to dispose the needle along with the syringe in the shaft, okay? Some people, what they do, they'll remove the needle and put in the shaft, and the syringe they'll put in the red bag. Don't do like that. In that process, you can get needle stick injury. All the puncture proof, the whole apparatus you have to put in the puncture proof. Okay, so that's all. This all for your topic for today, that is occupation health and safety. Just read your textbook once. Yes, needle with the syringe and sharp content. If you have just a syringe, okay, that is in the red bag. But if you have needle with syringe, you have to put without separating the needle from the syringe, directly the whole stuff you will put it in the puncture proof. Okay, so go through the PEP, post exposure prophylaxis, and occupation health and safety SOP from your infection control SOP. Okay, when you have time, just go through it so that you will know what is there in your hospital, what are things followed, what all benefits are given to the staff. Okay, suppose a staff says she's not able to stand for a long time. All management will have some consideration. After giving the medical certificate, they'll be shifted to another department. Okay, too much of AC is not allowed, so they'll be shifted to some OPD, SR. Okay, so all these considerations are there. So you should know what all safety benefits are there for you as a hospital employee. Okay, any doubts anybody is having? Anyone has any doubt? So tomorrow again, as usual, 3 o'clock will be your Six Sigma lecture, 4 o'clock quality management, and 5 o'clock infection control. Okay. No reminders for tomorrow. All of you, those who are free, try to attend it. Okay. So all of you have a happy weekend. Take care. Bye bye. See you next week.
Bye bye.